Hello, English learners. Welcome to a new podcast episode here on Story Orbit N. I'm Jessica.
And I'm Tom. Welcome back. We're so happy you're here because today we have a very interesting topic. It's something that everybody needs at some point in life, no matter where you live.
Yes, today we're talking about going to the doctor, health vocabulary, common expressions, and a little bit of how to survive that experience in English without panicking.
That's right. And honestly, this is so useful because nobody wants to feel nervous when they're already sick, right? Imagine you're sitting in a doctor's office feeling horrible, and now you have to explain everything in English. That's stressful.
It really is. I remember the first time I went to the doctor when I was traveling abroad. I had this huge headache and I tried to explain it in English, but I didn't know the word for headache. So I said something like, "My head is hurting very much." And the doctor smiled and said, "Oh, you have a headache." That's when I learned the word.
That's a classic story. So for everyone listening, let's start right there. The word headache, it means pain in your head. So if your head hurts, you say, I have a headache. Not I have pain in the head, which sounds weird. Some other examples are, I have a stomach ache, which means pain in your stomach, and I have a toothache, which means pain in your tooth. You can also say, I have a backache for back pain. Pretty easy once you know the pattern, right?
Yes, but here's something interesting. You can't use ache for every body part. For example, you don't say, "I have an earache" very often. People usually say, "My ear hurts." And you definitely wouldn't say, "I have a leg ache." That's not a natural expression in English. Instead, people say things like, "My leg hurts," or "I have pain in my leg." So just remember, we mainly use ache with words like headache, stomachache, toothache, and backache.
That's a great point. And here's another tip. When you go to the doctor, they often ask you questions like, what brings you in today? Or what seems to be the problem? And that basically means, why are you here? What's wrong? So don't panic if they say that. You can answer with something like, I have a headache or I have a sore throat. By the way, sore throat is another super useful phrase.
Oh, yes, a sore throat. That means your throat hurts, especially when you swallow, like when you have a cold or the flu. You can say, "I have a sore throat," or "My throat is sore." Both are correct. And speaking of colds, another phrase doctors might ask is, "Do you have a fever?" A fever means your body temperature is higher than normal. If you feel really hot and sweaty, that might be a fever.
Right? And if you don't know how to answer, just remember normal body temperature is about 37 degrees Celsius or 98.6 Fahrenheit. If it's higher, you have a fever. But you don't need to say numbers, just say, yes, I have a fever, or no, I don't have a fever. Oh, and you mentioned a cold or the flu. Let's explain those.
A cold is a common virus. It usually gives you a runny nose, sneezing, a sore throat, and sometimes a cough. It's not too serious, and most people get better in a few days. The flu or influenza is also a virus, but it's more serious than a cold. It can give you a high fever, body aches, chills, and make you feel very tired. Some people even need to stay in bed for several days.
So, colds and the flu are similar, but the flu is usually stronger and hits you harder.
Correct. Sometimes they ask, "Do you have any symptoms?" This is a great word to know. Symptoms means the things you feel when you're sick. For example, if you have the flu, your symptoms might be fever, headache, sore throat, and maybe a cough. So you could answer, "Yes, I have a headache and a cough."
Exactly. And another phrase is, how long have you had this? That means, for how many days have you been sick? So, you could say, I've had this for 2 days, or I've had this since Monday. And notice something here, Jessica. The question uses, have you had? And the answer uses, I've had. This is present perfect, which can be a little tricky for learners.
Oh, yes, great point. Let's explain that. So when the doctor asks, "How long have you had this?" they're asking about something that started in the past and continues now. The answer should also be in present perfect. "I've had this for 2 days." Not "I have this for 2 days," because that sounds incorrect in English. So remember, use "I've had this for" or "I've had this since." For example, "I've had this cough since Monday," or "I've had this headache for 3 days."
That's super useful. And here's another situation. The doctor might say, let me take your blood pressure. Do you know what blood pressure is? It's the force of your blood against the walls of your arteries. You don't need to explain it to the doctor, but you should know what they mean so you're not confused. They just put a cuff on your arm, it gets tight, and that's it.
And sometimes they say, let me check your pulse. That means they're going to check your heartbeat. Usually they touch your wrist or your neck to feel your pulse. Simple as that.
Another common expression is, take a deep breath. They say this when they listen to your lungs with a stethoscope, that instrument they put on your chest. They'll say, take a deep breath in and out. So just breathe deeply.
And if they want to know if you have allergies, they might ask, are you allergic to anything? If you are, you should say it. For example, I'm allergic to penicillin, or I'm allergic to peanuts. If not, you just say, no, I'm not allergic to anything.
Oh, and here's a big one. Sometimes they say, you need a prescription. What's that? A prescription is a paper the doctor gives you so you can buy medicine at the pharmacy. Without it, you can't get some medicines, so the doctor might say, I'll write you a prescription for antibiotics. Antibiotics are medicines that fight infections caused by bacteria.
Speaking of antibiotics, don't forget that in English we say, take medicine, not drink medicine. Many learners make that mistake because in some languages you say drink, but in English it's take medicine. For example, I need to take my pills 3 times a day, and pills are small pieces of medicine you swallow.
Yes, and also, you can say, I need to take a pill after meals. By the way, after meals means after you eat breakfast, lunch, or dinner, not snacks, only main meals.
Good clarification. Another word that's useful is appointment. When you go to the doctor, you don't say, I have a meeting with the doctor. You say, I have a doctor's appointment. For example, I have a doctor's appointment at 10 a.m. tomorrow.
That's so true. And if you call the clinic, you can say, I'd like to make an appointment with the doctor. And they might ask, what's the appointment for? You can answer, it's for a checkup or it's for a flu. A checkup is a regular visit to the doctor, even when you're not sick. It's just to check your overall health, like your blood pressure, weight, heart, and sometimes blood tests. The doctor looks for any early signs of problems and makes sure everything is working well. People usually go for a checkup once a year.
And let's not forget the phrase, I'm not feeling well. This is a very common way to say you feel sick. You can also say, I feel ill. But in American English, people use sick more often than ill. So you can say, I'm sick or I'm feeling sick.
And there's another interesting expression, under the weather. If someone says, I'm feeling under the weather, it means they're not feeling well. It's an idiom, so it doesn't mean they are under a cloud or something. It just means they feel sick.
I love that expression. It sounds cute, but it's serious. You can say, I can't come to work today. I'm feeling under the weather. That sounds polite and natural.
And sometimes you might need to explain the pain. The doctor could ask, is the pain sharp or dull? Sharp pain means it's strong and sudden, like a knife. Dull pain means it's not very strong, more like a constant ache. For example, I have a sharp pain in my chest or I have a dull pain in my back.
Another thing they ask is, does it hurt when I press here? That means the doctor is gently pushing on a part of your body, like your stomach or your leg, to check for pain. You can answer, yes, it hurts when you press, or no, it doesn't hurt. Simple answers are fine.
And what about expressions for recovery? If the doctor says, you need to rest, that means you should stay in bed, relax, and not do heavy work. They might also say, drink plenty of fluids, which means drink water, juice, tea, but not alcohol.
And if you need to go home after the appointment, they might say, follow up in a week. That means you need to come back and see the doctor again after 7 days. A follow-up is a second visit to check how you're doing. The doctor wants to see if you're getting better or if you need more treatment. It's a way to continue your care after the first visit.
Now, Jessica, we already talked about colds and the flu, but there are so many other common health problems people should know the names of in English.
Absolutely. Let's start with something very common, allergies. If you have an allergy, your body reacts to something like pollen, dust, or certain foods. For example, I have an allergy to peanuts, or I'm allergic to cats. Allergies can cause sneezing, itchy eyes, or even rashes on your skin. And here's a tip. If you sneeze a lot, people might say, bless you. It's a polite expression.
That's a good one. And speaking of sneezing, let's talk about hay fever. It's a type of allergy that happens in spring or summer when there's a lot of pollen. People sneeze, have a runny nose, and itchy eyes. So if you hear someone say, I have hay fever, it means they're allergic to pollen.
Yes, and then there's asthma. Asthma is a condition where people have trouble breathing because their airways get narrow. If someone says, I have asthma, it means they might need an inhaler, which is a small device that helps them breathe better. Doctors might ask, do you use an inhaler? So now you know what that is.
Another common one is food poisoning. That sounds scary, right? But it's just when you eat food that's gone bad or has bacteria. The symptoms are usually stomach ache, vomiting, and sometimes fever. So you can say, I think I have food poisoning if you feel really sick after eating something.
And the word vomiting is important. In everyday English, people often say throw up. So you can say, I threw up last night instead of I vomited last night. Both are correct, but throw up is more common in conversation.
Good point. And sometimes the doctor might ask, do you feel nauseous? That means, do you feel like you want to vomit? So if your stomach feels bad and you want to throw up, you say, I feel nauseous.
Let's also talk about infections. You might hear the doctor say, you have an infection. That means bacteria or a virus is in your body and making you sick. For example, a throat infection or an ear infection. Sometimes the doctor will give you antibiotics for that.
Yes, and if you cut yourself, the doctor might say, we need to clean the wound. A wound is an injury to the skin. If it's serious, they might need to give you stitches. Stitches are when they sew your skin to close the cut. So you could say, I needed stitches after I cut my hands.
And what about chronic diseases? That's another word to learn, chronic. It means a health problem that lasts for a long time, not just a few days. For example, diabetes is a chronic disease. That's when the body has trouble controlling sugar in the blood. So you can say, he has diabetes. Another example is arthritis, which is pain or swelling in the joints like the knees or fingers.
And let's not forget high blood pressure, also called hypertension. That's very common, especially in adults. If the doctor says you have high blood pressure, it means your blood pressure is higher than normal and you need to be careful.
On the other hand, if your blood sugar is too high, the doctor might say, you have high blood sugars or you're pre-diabetic. That means you're at risk of diabetes. So these words are important if you go for a checkup.
Another really common one is migraine. That's like a very strong headache, but worse. People with migraines sometimes can't look at light or hear loud sounds because it hurts so much. So you can say, I have a migraine when the headache is very intense.
Actually, I get migraines sometimes. They're horrible. And for stomach issues, people often say, I have an upset stomach.
Up the stomach is such a useful phrase because it's very general. If you don't know the exact problem, you can just say, I have an upset stomach. The doctor will understand.
And then there's constipation, which means you have trouble going to the bathroom. Many people feel shy saying that, but it's common. So you can say, I'm constipated.
And the opposite is diarrhea. That's when you go to the bathroom too often and it's very liquid. If you have diarrhea, you might also have dehydration. That's when your body loses too much water. So doctors often say, drink plenty of fluids.
Yes, and something really important, if you ever have chest pain, that can be serious. It might be something small, like muscle pain, but it could also be a heart problem. So always tell the doctor if you have chest pain.
Absolutely, never ignore chest pain. And speaking of heart problems, there's a phrase people use a lot, heartburn. But it's not your heart that burns. Heartburn is a burning feeling in your chest caused by stomach acid coming up into the tube that connects your mouth and stomach. It often happens after eating spicy or fatty food. You can say, I have heartburn after eating spicy food.
Great one. And let's not forget skin problems. If you have red spots or patches on your skin, that's called a rash. A rash can look like bumps, redness, or swelling. Sometimes it happens because of allergies or irritation. If the rash or your skin feels uncomfortable and makes you want to scratch, you say, my skin is itchy. Itchy means it causes a strong urge to scratch.
These are all so important. And I think now is a good time for a quick grammar tip. Did you notice that for many of these we use I have, like I have a headache, I have a sore throat, I have a rash. But for feelings, we often use I feel, like I feel nauseous or I feel dizzy. Dizzy means when your head spins and you feel like you might fall.
Exactly. And one more expression doctors love to use, let's run some tests.
That means they want to check your blood, maybe take an x-ray, things like that. So if you hear that, don't panic. It just means they want more information.
And after the test, they give you a diagnosis. That's another important word, diagnosis. It means the name of your illness. So the doctor might say, the diagnosis is flu, or the diagnosis is food poisoning.
And after that comes the treatment, which is what you need to do to get better. The treatment might be taking medicine, resting, or sometimes surgery. Surgery is when doctors operate on your body to fix something.
Surgery is serious, but don't worry, not every illness needs surgery. Most things just need rest and maybe some pills.
That's right. Now, before we finish, let's give a big summary of everything we talked about today so our listeners can review it all in one place.
Perfect idea. So today we talked about going to the doctor and all the useful vocabulary. We learned how to explain common problems like I have a headache, I have a sore throat, and also about symptoms like fever, cough, and nausea.
We also explained important phrases doctors use like, what seems to be the problem? How long have you had this? And are you allergic to anything? Remember to answer using present perfect for time. I've had this for 2 days.
Then we went over common health issues like allergies, hay fever, asthma, food poisoning, infections, migraines, constipation, diarrhea, heartburn, and rashes. And we explained the difference between I have and I feel.
We also covered important words like prescription, appointment, symptoms, diagnosis, treatment, and surgery. And some good advice expressions like take a deep breath, drink plenty of fluids, and get some rest.
That's a lot of useful English. So if you ever go to the doctor, you'll feel more confident and less nervous because now you know what to say and what to expect.
Exactly. And now it's your turn, listeners. Write in the comments, what new word did you learn today? And if you've ever been to the doctor in an English-speaking country, tell us about your experience.
Thank you so much for listening to this episode of Story Orbit N. Keep learning, keep practicing, and remember your health is important, so take care of yourself.
See you in the next episode. Stay healthy and happy.